Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm joined today by 5 experts from MedStar Health Physical Therapy: Lauren Valdata, Rebecca Schwender, Brittany Mafra, Dave Federline, and Darrell Springer. It is National Rehabilitation Awareness Week, and we thought now would be a great time to provide education around the various types of rehabilitation available to our patients. When most people think rehabilitation, they think physical therapy or occupational therapy, but there are a lot of subspecialties and services that can improve your injury or condition, pain levels, and overall quality of life. Some of those subspecialties include cancer, vestibular, neuro, pelvic, sports, and hand therapy. There are also different settings for therapy, including inpatient, outpatient, acute, and home care. Today's discussion is all about the wide world of rehabilitation. So thank you for joining us. Give us a like, let us know you're watching, and share this broadcast with your friends and family. To kick things off, we're going to start with the topic of cancer rehabilitation, and we're going to start with Dave Federline. Dave, my first question for you is, well, first, can you actually tell us a little bit about yourself and what you do and your specialty training?
Sure. So thanks for having us on, Karen. Happy Rehab Awareness Week to everybody. Yeah, cancer rehab is kind of something I grew into over my career, and we'll get into that a little bit. But I'm an occupational therapist. I've been here at MedStar Good Samaritan for 20 years in November. So it's been a long time, and love doing what I do. I'm also a lymphedema therapist, and I'm the cancer rehab program specialist for the northern sites for MedStar. So kind of your Franklin Square, Union, Harbor, Good Samaritan, and then some of the standalone clinics. And I have to mention my counterpart down in the South, Valerie Mulrine. She's our cancer rehab program specialist for the Southern hospitals. And then Yvonne Francis is our cancer clinical education specialist. So as a group, we were kind of tasked with growing the cancer program and educating the therapists across the network to be able to provide care to these patients.
Wonderful. Well, thank you so much, and thank you for joining us. Here's my question for you. Can you explain to us the scope of cancer rehabilitation and the various treatment programs that are offered?
Yeah, so it kind of grew out. I started my career as a brain injury specialist, so cancer rehab really wasn't on my radar. When I came here to Good Sam, they wanted to start a lymphedema program. So from there, it kind of spiraled. So when I started the lymphedema program, I got trained in upper extremity and lower extremity lymphedema. And as an occupational therapist, I kind of tended toward the upper extremity. Upper extremity lymphedema is typically after breast cancer. So I was seeing post-breast cancer patients for lymphedema specifically. And then there's so many different impacts of treatment, post-surgical radiation, chemotherapy, all those side effects that can happen from that. So even more so than lymphedema, there were, these patients were coming in for lymphedema, but had all these other side effects. And so then I started doing a lot of my continuing ed on cancer rehab in general. So really it runs the gamut from, we have now started prehab programs, we have rehab programs, and then survivorship programs. So really kind of addressing the whole gamut from prehab once they have their diagnosis. We have a multidisciplinary clinic that we work with our surgeons, our medical oncologists, our radiation oncologists, and kind of come up with a whole plan. And they've really, the doctors have really welcomed therapy as a crucial part of, the cancer process. And realizing that it extends past lymphedema was kind of the first step. and then kind of getting educated. One stat that I wanted to go over was that there are 2 million people will be diagnosed with cancer in America this year. And then there are 18.5 million that are survivors living with cancer. So all of these patients, well, I would say most of these patients have some type of need that would benefit from rehab. For some reason, for the longest time, patients weren't being referred to rehab even after surgery. Every other surgery you have a knee surgery, you go to rehab. You have, spinal cord injury, you go to rehab. But for some reason, after breast cancer surgery, you weren't going to rehab. And so that's really our push, is to have therapists trained to be able to see these patients, and then so that we can meet all their needs, post-surgical, post-radiation, post-chemo. So really a wide gamut of rehab, and it's something that I've really grown into and grown to love. This population is just, they need our services, and so we're always recruiting for oncology rehab therapists. So if you are interested, we have a cancer pod throughout MedStar that we work with for our therapists out there, and for our patients. If you're having any issues, get in touch with our rehab department, and we'll hook you up.
Thank you so much. So you mentioned lymphedema a couple times. What is lymphedema, and how can rehab help?
So lymphedema is a very unfortunate, sometimes side effect of post-surgical. So with breast cancer specifically, you have lymph nodes removed so that the cancer doesn't spread. So if you have, and there's varying risk factors. If you have a mastectomy versus a lumpectomy, the risk factor might be more. If you have radiation following, because it can do damage to the lymphatic system. So lymphedema is really when that lymphatic system kind of goes haywire, and you can't, the edema kind of settles in the extremity that was operated on, or in the chest, breast, trunk region. And it doesn't go away with exercise, elevation, all the typical things we get rid of swelling with. It won't go away. So you manage it through therapy. So we have lymphedema therapists that do 2 phases, really. The phase 1 is when the patient comes into the clinic. We do lymphatic drainage. We, kind of move that fluid out. And then we do compression wrapping to almost shape that arm or, leg if it's lower extremity lymphedema. For our breast cancer patients, it's most often the upper extremity that was operated or is being treated. And then so phase 1 is doing the lymphatic drainage, doing the compression to try to shrink that arm down, shape that arm to almost match the other arm. And then phase 2 is them managing at home, whether it's with a sleeve, a glove, compression pumps that patients can get for home. So just being the resource for these patients to be able to manage what can be a very debilitating condition that happens after cancer. And that's really why we got the prehab program going, because for years, patients were coming, 6 months after the fact. And I was like, when did the swelling start? And they're like, well, 6 months ago. It started pretty much right after the surgery. And we really would want them to come back sooner versus later, so that the problem doesn't persist. Because if we catch it early, if we get a compression garment on early, we can really kind of reverse any of those functional side effects. There's no cure for lymphedema per se, but we can, kind of, if we catch the potential side effects early or get early treatment, we have much better outcomes.
Mm-hmm. Wonderful. Well, thank you so much, Dave. Really appreciate it. It was great hearing about cancer rehabilitation. You're doing some wonderful work there. So appreciate all the perspectives and information for our viewers. We're going to talk next about vestibular therapy. I'm going to go next to Brittany Mafra. Brittany, can you tell us a little bit about yourself and the subspecialty of vestibular therapy?
Of course. So my name is Brittany. I work out of the Rockville Clinic, and I've been with MedStar for 6 years, primarily all neuro, with my subspecialties of vestibular and concussion. I am currently the concussion program, one of the concussion program specialists within MedStar. But neuro realm is my jam, and vestibular is what I see a lot of, especially with that concussion. So vestibular therapy is essentially the treatment of dizziness and imbalance. So a lot of times people feel that imbalance and they don't realize that it could be coming from their vestibular system. So the vestibular system is within your inner ear, and it's made of fluid. So if anytime that fluid gets off balanced, it could make you feel off balanced. And it's a range of things. So it can vestibular therapy is kind of like the treatment of dizziness. And dizziness is kind of like the top of the umbrella. And then there's a ton of terms underneath of that umbrella, which can be like feeling like you're on a boat, feeling like the room is spinning around you, feeling motion sickness. All of that isn't like normal and should be treated by a vestibular therapist.
All right, thank you so much. And what conditions can benefit from vestibular therapy and how?
Yeah, so again, since that like imbalance part of vestibular therapy is under that umbrella, there's a ton of conditions, right, that can fall under that. So it could just be like that motion sickness. A specific diagnoses would be like BPPV, which stands for benign paroxysmal positional vertigo. So that is usually like if someone lies down at night and they feel dizzy, or they sit up in the morning and feel dizzy, or bending over. More specifically, it's like if the room feels like it's completely spinning. Also things like Meniere's, which is like periodic dizziness. So that's when you can just be sitting at your computer and all of a sudden it feels like the world is spinning on its axis and you feel like you're going to fall over. Motion sickness is another common one that vestibular therapists treat. And then just generalized dizziness. So even something as specific as like a stroke, and specifically if that stroke has been in the cerebellum, or if people have a tumor from cancer in the cerebellum, a traumatic brain injury that affects the cerebellum, the balance and coordination of balance can be really thrown off. So that's when a vestibular specialist would be kind of recommended over just a general neuro specialist, because of the vestibular piece of that cerebellum. Concussion is a really big one too, where vestibular specialty is also needed, because there's a huge vestibular component usually within that concussion realm.
All right, thank you. You've mentioned neuro a couple times. What is neuro rehabilitation and how is that different from vestibular therapy?
Yeah, so specifically for neuro is going to be something that is within like the central nervous system. So something within the brain or something within the spinal cord. And so that usually breaks connections to the rest of the body. So as a neurotherapist, so like the nervous system can sometimes regenerate, and it regenerates really slowly. But it can. And so for neurotherapy, we're trying to retrain that system to function, kind of like hopping back on a bike, but now you have to relearn how to ride that bike. Or if it's something that's more of a permanent thing, like part of my brain was removed, right? Or now I'm a spinal cord injury and my legs don't function. You have to kind of learn how to compensate for those impairments that aren't going to come back. So as neurotherapists, we're either trying to retrain the system to ride that bike again and know how to ride that bike again, or retraining new systems to compensate for what can't be relearned.
All right, thank you. And what conditions can benefit from neuro rehab?
A huge array of conditions. So we get things even just like cancer patients, for example. They a lot of times will have some paresthesias or neuropathies after chemo or radiation treatments. And so I see a lot of patients that can no longer really feel their feet from their chemo treatments. And so then I have to retrain other parts of their body to read their balance systems. But more commonly, it's going to be like your strokes, traumatic brain injuries, spinal cord injuries, muscular dystrophies, um, uh, your multiple sclerosis, your Lyme's disease, cerebral palsy, ALS. Like there's so many things that fall under that neuro realm. So I would say the best way to kind of remember or know if something is neuro is, was it found within the brain or within the spinal cord? Because those are the things that are going to be under that neuro umbrella.
All right, makes sense. Thank you so much. I can imagine all the things that you mentioned, the dizziness and the motion sickness and feeling like the room is spinning. It's probably pretty disorienting and challenging to deal with that among all, I'm sure, all the other things that you're dealing with a lot of the conditions that you mentioned. So having this therapy could be really life-changing for you, really helpful.
Yeah, I would say a lot of people though, like they don't know that there's therapies that can help them when it comes to dizziness, and they'll go to their doctor and their doctor will prescribe a medication that like decreases dizziness, which is great. But even within just like the medical realm, it's not well known that these are things that can be fixed and be treated, just by trying to integrate that system and work specifically on that system.
Yeah. All right. Well, thank you so much. I'm going to pause for a moment just to welcome our viewers again. Thank you for joining us. We are celebrating National Rehabilitation Awareness Week, and we're here with 5 of our experts who are talking about various aspects of rehabilitation. We've talked about cancer rehabilitation and vestibular therapy. We're going to talk next about sports. So I'm going to turn it over to Darrell Springer. Darrell, welcome, and thank you for joining us. Before we get started, can you talk a little bit about yourself and what you do at MedStar?
Yes, thank you for having me. Yeah, so I'm Darrell. I'm a sports PT. I'm currently on the tail end of my sports residency. And I've been with MedStar for 2 years now. Sports rehab is, I think, an amazing thing that we offer at MedStar, something I think we've done really well. And for those of you who are not as familiar, we see all types of athletes. So student athletes, but also your recreational athletes who have pain, and the pain can range from just like you might have strained your calf, or you might have had a major surgery like an ACL or an Achilles tear. And what we do is we take that orthopedic condition, kind of educate you one, but then also teach you how to get stronger and how you progress back into the sport that you like to play.
All right, thank you. You mentioned ACL tears. Can you tell us a little bit more about your return to play program and what that means for athletes?
Yeah, so the sports physical therapists within our system typically go through a return to play type of education and check off to make sure that people who are coming back from an ACL, we have a standardized system that basically makes sure that if you're coming back from an ACL injury, you're ready to go when you come back. The process can be kind of lengthy, anywhere from 9 to 12 months in regards to getting back to sport. But what we do is we have certain checkoffs, making sure that you have the correct amount of motion, the correct amount of strength. And then at the tail end of your therapy, we're looking at certain tests. We're doing a lot of hopping tests and making sure that you have appropriate symmetry there. I'm looking at the quality of your movement and then taking you through certain sports like movements to make sure that when you go through them, your knee is bending appropriately, you're not compensating in certain manners that might put you at risk for re-injuring yourself.
All right, thank you very much. Some of the therapists at MedStar Health are certified by TITList. What does that program entail, and how does that benefit our patients?
Yeah, so that program, for all the viewers out there, if you're looking and you see someone has this TPI certification, yeah, that is a certification that essentially allows them to work heavily with golfers. What it does is you look at the different movements, you're breaking down your hips and your spine, the way your arms move. They can look at those specifically, but then also take them and then see if you have this amount of range of motion, or if you move with your spine before your hips, okay, how does that play into your golf swing and your overall stroke? So it's really nice, especially you'll see people coming back from total knee or total hip injuries. And if they're injured, okay, this is what's happening during your golf swing. We have rehabbed your knee in isolation, but let's rehab your knee in regards to you getting back to golf. And this is what's happening when this is what we can do to make that a little bit better.
All right, thank you. MedStar Health has a comprehensive running medicine program. How does therapy play a role in the training and recovery of the runner?
Yes, so this is huge. Actually, just this past weekend, in the DC area, MedStar was collaborating with Pacers, and we were helping host the DC Half Marathon. So we're providing all the medical coverage there. I think this is a great opportunity for the patients in the clinic to understand that we're not only in the clinics, but we're also out at events and providing medical coverage there. A lot of our sports PTs also have their emergency responder for athletes. So you'll see us at various events. And not to get too far from running, but we also were out there at the ACC tournament for basketball. And some of our therapists work in the collegiate setting. So you'll see us all around. But to come back to running, yeah, we basically we can do a lot of great things for you. Again, looking at if you're having ankle pain, knee pain, okay, let's teach you exercises, educate you on maybe things that you can do in your runs. Maybe you can do a warm up beforehand or a cool down afterwards. Should we change how frequently you're running or the pace of your running potentially? But then also we can do a gait analysis for you. So we break down the stride of your run and what's happening as you're going through each stride. And really, unless you're a running coach, our goal is not to change how you're running, but how that influences the stress that's placed on your body and how we're going to rehab certain parts of your body. If we can strengthen certain areas, maybe your gait naturally looks better as you're going through running. And then the coolest part about it is, and this just happened with myself, we do a gait analysis, we treat the area, we kind of teach you how to progress through your running so you're not picking up mileage too quickly. And then we go out to an event and just it just so happens that I'm working the event that you're training for, and then we get to see you cross the finish line. And again, for the viewers out there, if you are running these races and you see MedStar out there, definitely come by. We usually have some recovery tents set up where you can, if you felt some pain during your run, get a physical therapy evaluation. We can let you know, hey, I think that you're a good candidate to come into PT, or I think you should see an orthopedist, or maybe, something further. We also have some cool tools out there, like massage guns, or some compression boots that just help you recover and feel good after the run.
Nice. All right. Thank you so much. Sports rehab has a lot of different equipment and modalities that can be used. Can you talk to us about some of the more popular ones like dry needling, cupping, and blood flow restricted therapy?
Yeah, so dry needling and cupping are some manual type of techniques that we like to use. If you're an athlete and you're working hard, typically you're going to come in with some muscular tightness. A lot of our therapists are needling certified, so this allows you to, if you have a tight spot that's your trigger point, your therapist is going to do an evaluation, see what's going on. If they find that there is this painful spot that they feel is a trigger point, an option to use is dry needling. The stimulus of the needle hitting the trigger point allows these natural chemicals in your body that are causing this tight spot to kind of go away and release some of that tissue tension that could be causing some of your pain. Cupping is super similar, where you've probably seen, I think the best example is probably Michael Phelps when he was in the Olympics. You see like all these cupping marks, or you'll frequently see basketball players with all these cupping marks on them. Again, kind of getting away from some of these fascial adhesions and these tight spots in the body that help you relieve the pain. And actually for me, the way I educate my patient is we're taking away this painful spot that is potentially contributing to what's going on, and then we're going to go and strengthen it so this doesn't happen on the back end. BFR, or blood flow restriction, is a very good tool to use. I think most properly used post-operatively when there are some restrictions in place. So basically what this does is, exact name, it restricts the blood flow in the area, and this, without getting too much into it, basically makes it feel like it's really hard to do your exercise without having to load you up with a bunch of weight. So now we can respect any precautions that have been placed by the surgeon to make sure that you're not using a lot of weight right away, but you're still doing a lot of hard work, which is going to help you build strength and hypertrophy, or make the muscle bigger in a safe manner. The other cool thing, I just want to throw this out here, that a lot of our therapists are doing, we're using some tools such as force plates. So if you're on MedStar's physical therapy Instagram page, you'll see a lot of work there that just looks at the amount of force you're generating when you're jumping or standing, how long it takes to balance, and then even, you know, something further for our other therapists on the line, you can use for your general population, your neuro patient who's having problems balancing. How long does it take you to stabilize, or does your squat look good? And then we're also using tools that help us give objective measures to strength. And those are kind of some of the things that play an important role in your return to sport, so that we are not just guessing, but we objectively know that you have the strength and the balance and the coordination to get back to your sport effectively.
That's great. Thank you so much. Sports can take a big toll on your body, so having the support from MedStar Health Sports Rehab, even before or after sports, hopefully there's no injuries, but obviously we help with those as well, is really important to keep our athletes doing what they love to do. So thank you so much for sharing all that information.
You're welcome.
All right, we're going to talk next to Lauren Valdata. She is a certified hand therapist. Hi, Lauren. Can you tell us a little bit about yourself? And can you tell me how a CHT is different from a PT?
So I am a physical therapist by background. I've also been a CHT, which is, again, certified hand therapist since the original exam that was in 1991. And basically a certified hand therapist can either be a PT and or an OT, and it's basically a merging of both professions, so that it's a combination of, say, an art and a science of the rehabilitation of the upper limb from the fingertips to the shoulder. And basically we work with, you know, very specific tendon and fracture problems that would be more specific than a regular PT would be needed for.
All right. Well, thank you so much. Can you share some examples of when a hand therapist may be needed or preferred for an injury or condition?
Again, regular PTs and or OTs treat these problems as well, but as a certified hand therapist, you've done more specialized training. You have to be take an exam and then be recertified every 5 years, so that essentially you're would be a more specific specialist in the area of, say, replantations or revascularizations of people's injuries, where tendons are cut in fingers or arms. That's another thing where a regular therapist, say, would feel comfortable maybe working with a wrist fracture, where you're going to be doing your exercises and pain control. But when it gets into more specific detail with a more intense knowledge of the anatomy, I think that's where the hand and upper extremity therapist really can show more, not necessarily more progress, but is able to help that patient a little bit more specifically than general therapy as such.
Makes sense. Thank you so much.
Sure.
And MedStar Health has a performing arts therapy program. What types of patients or injuries have you treated in your profession?
Well, just again, going into the more specifics, we see lots of cumulative trauma as well as overuse problems, from computer problems as well as with musicians. They play many, many hours. We have the Peabody Conservatory as well as Morgan State as well, or Morgan, as well as Towson also have music programs. So we have the BSO, and in addition, people are constantly practicing, so they tend to have many different problems. It can be classically tendinitis types of problems. And or their posture is not good, so now they're having back problems in addition to it. So we pretty much would work from, again, fingers for arthritis. A lot of patients are getting older, so we have a lot of thumb arthritis, carpal metacarpal, which is right in the base of your wrist and thumb. So we get to see a lot of people with that. Years ago, it would just be, say, an injection the doctor would typically give, but now we know that with therapy and conditioning as well as splinting, that's something I didn't mention, but both PTs and OTs in hand and upper extremity do a lot of different types of splinting for injuries, where years ago they did casts all the time, but now we use different thermoplastic materials that someone who broke their wrist yesterday, may be going into a splint rather than a cast for the next 4 to 6 weeks. So in that respect, we see a lot of those cumulative traumas. And with the musicians as well, I look at the way they hold their instrument. Is it a specific problem? Is it their posture that's causing it? So it's a full body type of treatment where you're really looking at that full person and trying to condition their body, because musicians are not looked at, say, as sports people, but they are the small muscle athletes of the world, and they play many, many hours, sometimes on certain passages, and that repetition really causes a lot of problems. So again, it's majority of it would be pain control in the beginning, but then it's also a reconditioning for their full body so that they can then spend more time playing their instrument as well as going back to their profession. It's for both amateur musicians as well as professionals. And our clientele or patients can be from, we have the Baltimore School of the Arts here, so we have a lot of performing artists there, and treat, young under 11 years old up to 95 years old after they've had a surgical procedure for, as I was talking about, that CMC or thumb arthritis. They'll have the surgery and then need the therapy to get them moving. And then from there, they then go to the more music specific, back to playing their cello or piano, violin.
All right, thank you so much. Your hands are obviously an important part of your body and something that everybody needs to do things easily. And obviously musicians, having their hands available to play their instruments and do all the wonderful things that they do are equally important. So it's wonderful to hear about the services that we offer specifically for your hands
Right.
when it comes to therapy. So thank you so much for sharing all that information.
My pleasure. Thank you.
All right. And then last but not least, we're going to go to Rebecca Schwender. She is specially trained in the world of pelvic health, not public health, pelvic health. Rebecca, tell us a little bit about your profession and what types of injuries and conditions you treat.
Good afternoon, everyone. I'm Rebecca Schwender. So I am a physical therapist by training. I've been working as a physical therapist for 10 years with MedStar Health. Similar to my colleague Dave, who spoke at the top of our talk today, my career started actually in orthopedics and then evolved into pelvic health. So some of that evolution for me, I personally enjoy running. As we heard from Darrell Springer, we have a robust running program, as I've been involved with that throughout my time with MedStar Health. And my interest in pelvic health kind of stemmed from that. Postpartum, some athletes are returning to running and they're having difficulty with pelvic heaviness or urinary incontinence with running. And it seemed to me to be an injustice. And I wanted to learn more. How can I help with that? How can my profession help with that? And so that's kind of how I got into the world of pelvic health. And pelvic health encompasses many different diagnoses. Some conditions are underactive pelvic floor conditions, and then some are overactive pelvic floor conditions. So I do treat things that kind of go into that realm of urinary incontinence or pelvic organ prolapse, but also on the other side of the spectrum, pelvic pain or constipation are problems that pelvic floor physical therapy very specifically can help those patients to address. And even though pelvic health physical therapy is kind of a subspecialty underneath the physical therapy, it's very much related to what all physical therapists do. I take the neuromuscular and musculoskeletal systems and assess those systems and see how is that affecting your function. Because a patient that's having functional limitations, such as urinary incontinence or fecal incontinence, that's going to have significant implications on quality of life, of maybe choosing not to go out and enjoy life because of these pelvic problems. So what I can do to help patients restore that function and be in better control of that function, I find that incredibly empowering, and that's what really drew me into wanting to work in this profession of pelvic health.
All right, thank you so much. Yeah, you mentioned postpartum. Many women experience a weakened pelvic floor after childbirth, one of the many beauties of giving birth. How are you able to help these patients, and when do you recommend they seek professional help?
Right. So childbirth is certainly a trauma. It's a planned trauma. It's a beautiful trauma, but it is still trauma to the musculoskeletal system nonetheless. And even before the actual delivery, just the increased weight that a woman will experience throughout pregnancy can affect the pelvic floor. So you have certainly the weight of the baby that's gained, but then also the placenta, additional blood through the circulatory system. And all of that is then putting pressure on the pelvic floor. And as the child continues to grow in size inside of the uterus kind of squashes down the bladder to the size of a pancake. So urinary frequency is very common, especially as a woman enters that second and then into the third trimester. And so some of those symptoms can be normal of having urinary frequency during pregnancy. But then if that symptom is persisting postpartum, that's where pelvic floor physical therapy can be more influential. So some symptoms do happen because pregnancy is a transient state. But then postpartum, it's expected that whether it was a vaginal delivery or cesarean delivery, you can still have some of these symptoms just because of all of that weight during pregnancy. There are some greater risks with a vaginal delivery because the child is delivered through the pelvic outlet. And so there's pressure put and stretch put on all of these pelvic floor muscles during that delivery method. And just as my colleague Jarrell was talking about with sports rehabilitation, these muscles are impacted. A patient that has an ACL reconstruction, their quadricep muscle isn't going to function normally because they had a surgical incision, they had swelling. The same is true with these pelvic floor muscles. After delivery, those muscles are just operating a little bit differently, and there is a recovery period. So typically at 6 weeks postpartum, women will return to their obstetrician for a checkup. And most of the symptoms postpartum, if there is any urinary incontinence, pelvic heaviness, should be improving by that 6-week visit. Some of these symptoms can take that full 4th trimester or 13 weeks postpartum to return to normal. But even at that 6-week visit with the obstetrician, if you're still experiencing pelvic heaviness, pelvic pain, or urinary incontinence, that's a good time to bring it up to the obstetrician and talk about maybe getting a little bit of additional support. Because while these symptoms do happen commonly postpartum, it's not normal for it to last forever. And there is help out there, and that help can be sought.
All right, thank you so much. Men can also experience pelvic pain and incontinence issues. How can pelvic therapy help male patients who may be experiencing these?
Right, so everybody drinks, everybody eats, so everybody pees, everybody poops. Doesn't matter what gender you're assigned at birth. So men have pelvic floor muscles just as women do. And so these similar dysfunctions can occur, whether that's urinary incontinence, fecal incontinence, constipation, and pelvic pain. men do have that risk with having a prostate, of the risk of prostate cancer. So when that cancer treatment with prostatectomy, of the removal of that prostate, can very commonly lead to urinary incontinence after that surgical procedure. So kind of specific to the male population, that's something that pelvic floor physical therapy can help with, is restoring that continence mechanism after the anatomy has changed because of treatment for cancer. Erectile dysfunction is also another symptom specific to the male population that can benefit from pelvic floor physical therapy. And we've talked a lot so far about kind of adult populations, but even children, pediatrics can benefit from pelvic floor physical therapy as well. Current guidelines from the American Academy of Pediatrics recommends that children should be toilet trained by the age of 4. So if a child has not been fully toilet trained by the age of 4, that's considered developmental delay, and therapy can be a service to help children with learning how to use the toilet. Common cause that I see of that is often constipation. And some of that can not only be physical, but also kind of the fear elements of using a public restroom as part of me falling out. You know, children have kind of a different way of perceiving the world than we do as adults, but still need to learn that skill of continence. Yeah.
All right. Well, thank you so much. That was wonderful information. I'm going to take a moment now just to go back to each of our panelists. That was all the questions, specific questions that I had for each of you. But I would like to, right before we wrap up our broadcast, just ask if there's anything else you want to make sure our viewers know or that they take away from today's discussion before we wrap up. I'm going to go in the same order that we went in previously, and I'm going to start with you, Dave.
Yeah, no, I think it's great hearing about all the programs that MedStar has to offer. You know, it's been awesome how they've kind of supported me through my journey of becoming a cancer rehab specialist. Just encouraging everyone out there, you know, all the therapists to kind of learn about all the oncology things, because even if you're doing sports or if you're doing pelvic health, we're working with Becca a lot. There are a lot of cancer side effects that impact pelvic health, but even with our hand therapists, some of the other medications and all can cause joint problems down the road. So you are going to have patients that have, at the very least, a comorbidity of cancer. So you might as well learn about it and you know, kind of embrace it. We're going to have more survivors that have things that they want to deal with, and you want to live a active, healthy, happy life. And we can be the therapist that kind of help these patients go through that. So
Sure.
Yeah.
Wonderful. Thank you so much, Dave. Brittany, how about you?
I don't have much. I just want to say thank you. I do think that we all do kind of, I recommend pelvic health all the time for a lot of the neuro population. And I know that I've had several like sports patients actually come over to my side because it seems more like, there's something going on here, but like it might be more on the neuro realm because like orthopedically it all looks fine. So I think that we all, you know, refer out to each other very frequently. And I think that's one thing MedStar is just really good about, is that like inclusive, like cohesion between different specialties.
Absolutely. Our patients have a team, and there's, you know, someone who can help you in all those different areas of need. So thank you for that, Brittany. Darrell, anything from you?
Yeah, I just really wanted to say I appreciate all of these specialties coming together, because just like everyone's mentioned, we do work really closely. I didn't mention that some of our sports therapists also treat concussion, but I do think that's important. And for myself, I think the patient finds a lot of peace in this, but if I'm treating your concussion and, you know, I find like, okay, maybe this is just more advanced than I've seen, then it's nice, because then I can pass them off to someone like Brittany, who maybe sees concussion a little bit more frequently than myself. And they're in good hands. And I think the patient always feels good about that, just knowing that we're all connected. And I mean, even I've had experiences with runners who had pelvic dysfunction. I wish I knew Rebecca at the time. I would have sent them to her, but I sent them to a pelvic floor therapist right away because I educated them on the fact that that is not something that you have to deal with. And I think she thought that that was normal after having a kid. And I kind of just educated her, like, it doesn't have to be that way. There are therapists that I know that can help you with that, and patients just love that. But I think it's just nice when we're all working together like this, and stuff like this really highlights that. So yeah, I appreciate the opportunity. Last little thing, um, if you are a viewer and you know you're uh, having a nagging injury and you're about to get into a sport, don't hesitate to come in. At the very least, what we can do is get you in for one visit, kind of educate you on the sport, things that you can do. It doesn't mean that you always have to do a full kind of plan of care for physical therapy, but we can get you set up on the right track. And sometimes we do find something that's a little bit more. So I always like when people come in and they're not sure if they should be in, and we just educate them and help them out. So yeah.
All right, thanks, Terrell. Yep, that's what this is all about, providing education. I appreciate your final thoughts. Lauren.
Yes. One of the things I'd like to mention is that the Curtis National Hand Center at Union Memorial is our main huge hand center where all our hand and upper extremity surgeons are as well. But we do have many different satellites throughout Maryland, Virginia, and surrounding areas that a lot of patients now are able to have their therapy in, and actually also see their hand surgeons in different satellites as well. So it's more broadened rather than just being in the Baltimore area. I thought that was important. And in addition, we also have something called the Curtis National Hand Center Work Hardening Program, where we actually have therapists that specializes after you finish your hand and upper extremity therapy. You now are able to do your activities of daily living or your ADLs, but you're not able to actually go back to your job or your work because, say, you're a trucker or you're a fireman. And so we have something where our therapists do functional evaluation as well as work capacity evaluations. And then they go through anywhere from a 2 to 3 week to up to a 6-week program where they actually train the people to then go back to their job, and or if they're not able to then proceed to see where they can go on to possibly have another job or future profession. And the last thing also is with the music consultation clinic that we have now. We're very lucky to have a doctor named Dr. Raymond Whitstadt, who is one of the first performing arts medical doctors that is now certified, as well as an orthopedic, as well as a hand surgeon. And we have a music consultation clinic every fourth Wednesday of the month, where musicians can come with their instrument and have an Alexander Technique therapist, myself as the certified hand therapist, and the doctor who's the specialist. And we have, it's not like, say, where you see a doctor for a few moments or 15 minutes. It depends. The person can be there up to, 30 minutes to 45 minutes, because we'll actually look at you with your instrument and, see what your condition is, et cetera, et cetera. And we have a piano as well as at the hand center. So we're able to, have the person, because again, can't carry your piano, but we do have one access as well. So it really tries to, really get that person back to their profession so that they can perform or just play because they love their instrument.
That
Thank
is
you.
wonderful. That is a great service offering. So thank you for sharing that.
My pleasure.
Yeah. And finally, Rebecca.
So I would add in when thinking about pelvic floor rehabilitation, I will share that it's not all Kegels. So depending on kind of what the condition is that I'm treating, sometimes strengthening the pelvic floor is important, but sometimes actually doing the opposite is important too. And there's some research that shows even when you just say, oh, go do Kegels, about 50% of people do them incorrectly. So having some expert guidance can be really beneficial to efficiently get you back to your goal quickly and the right way. And I would tag on to what Brittany shared. if you're a patient and you're receiving therapy services, whether you're seeing a physical therapist, an occupational therapist, the speech language pathologist, if you're having a functional limitation, say something. That person may not be a specialist in that area, but with all of the service offerings we have throughout MedStar Health, there's someone in our network that does it. So if you're a patient, just bring up the conversation and your medical team will get you to where you need to be.
Thank you so much, Rebecca. That's really helpful. Well, that is all the time we have for today. As you can see, there are many ways that rehabilitation can help reduce pain and improve your quality of life. So thank you for tuning in and participating in today's discussion. Thank you so much to our panelists for your time and expertise. I know we're all very busy, so we appreciate you spending time with us. If you have any questions, you can leave them in the comments. You can also visit us at medstarhealth.org/physical therapy. We'll put that link as well in the comments. You can easily find more information about our services. And happy National Rehabilitation Awareness Week. Thank you so much.